when my father was diagnosed with lung cancer, that's when I knew that this is what I was going to my life, my professional life, dedicated to this. Then I was invited by different doctors, and I started working in other hospitals where I was exposed to a wide variety of different treatments and therapies. Some of them worked, some of them didn't work back then, and throughout around 10 years experience when I was working for other people before starting my own practice, I had the opportunity to test and to see which therapies work, what were not, and gave me the opportunity to study as well, because I went to a lot of different meetings and countries where I learned different treatments. So based on experience and also doing research, I did some research myself. That's how I came up with this program after evaluating a wide variety of therapies that are available on the internet. But basically the program is designed to address cancer cell weaknesses, each cancer cell weaknesses, right? For example, we use the whole body hyperthermia, the local hyperthermia, because and infrared heat and other laser and all of those type of treatments, because we know that cancer cells do not tolerate temperature, right, above 104. So like that, we are addressing each cancer cell weakness, oxygen therapies and low glucose diet and heat treatments and immune therapies. That's one of the main things that we do, and we started all this probably we started researching with the immune system and cancer probably around 20 years ago, 20 something years. Back then it was people laugh at that, it was chemo and it was chemo and that's it. And nowadays everything is immune therapies, but we have that advantage that we started with this many years ago, researching and knowing that immune system was an extremely important factor in the long-term fight against cancer. And medications now are being developed, but still with a lot of different side effects and problems. So I still think that the program that we have is the best program to fight cancer, definitely.
Doctor, I have been studying your methods, and I've been looking at the different equipment that you have. I've learned about the different solutions that are injected through IV, but I've also learned about vaccines.
Yes.
Tell us a little bit more about vaccines, doctor.
Well, vaccines are again, back then was nothing to look at in treatment of cancer. Nowadays, vaccines have been developed for different cancers. Viral vaccines, vectors, where these viruses are used to infect cancer cells and to attract the immune system. So that's basically how these viral vector vaccines work. There were also other type of vaccines like dendritic cells, other vaccines that are more like trying to the immune system to be able to recognize cancer. And we have many of those vaccines available here in combination with many other therapies as well.
I also have been paying attention to the equipment that you have, and my understanding is that a lot of the equipment are energy generators, such as radiant heat, for example, sound waves, ultrasound waves, harmonic energies,
bioresonance.
So tell us about the why you have selected these different machines or equipment?
Again, it's because of the experience that I have on the combination of different therapies that we have that work together with one another. We have Halo, for example, which is a light therapy in combination with botanicals, that the main thing is to boost immune function against cancer. We have like a sonodynamic treatment where we give a substance that is called porphyrins. Those porphyrins are absorbed by cancer, and then you expose the cancer to an ultrasound frequency. Other bioresonance treatments that we have is, for example, Rive, well known. It's been around for quite a while, but we have probably the best devices with that. We have Beamer, which is another new treatment that we have. And so we have a combination of therapies that each one will have a role in fighting cancer. And all of them are important, and that's why we have these intensive treatments, because each therapy synergizes with the other therapies to give better results. Definitely, we try for all of the patients to receive all of the things that we offer in the package. Some of the patients will need more different treatments, but those are very particular ones that we talk to them when they're here. But yeah, definitely we want to do as much as possible. If the patient tolerates, we need to check kidney, liver function. We need to check that the patient first and foremost is able to tolerate these treatments, and we're not causing any more problems. Even though all of these therapies are safe, okay, they won't cause any problems or side effects or complications, but we just need to make sure that the patient is good enough for the IVs and things like that. The patients that we receive here many times are already compromised, already treated with a lot of chemos, radiations. Unfortunately, 95% of the patients that we receive here are stage 4. And the length of the treatment is because that's the time we need to see a response. And some patients, we do recommend them to stay a little bit longer after the 3-week evaluation. If we see that we're getting good response, definitely we recommend them to stay longer. But then that's decided here and depending on these factors. First, we offer the most complete program here against cancer with the most variety of different treatments. We have a very personalized care, but also it's very important the heart that we put into each patient, and the team, all of the staff here from kitchen to maintenance, we have the same goal, that is to help patients get over this serious problem. And technologically speaking, we have everything from a surgery room to the most latest devices for treatment. We have a high qualified staff, certified doctors, certified specialists. We have a full licensed hospital where we can treat any problem. But where other places, well, they're not as prepared to deal with serious cancers or serious sick patients. So in summary, I think is primarily the care that we give, the attention, and we want really to help. That's, I think, the main reason why I recommend people to come here, because we are committed to find a way and to find an option for patients to get better. Secondly, it's a very nice hospital, very well staffed, very well qualified with the latest treatments, and we're always looking and searching for the best therapies, and that never stops. My goal of I will sit down with the patient when it's time for them to go home, and I'll make the home program myself, and I'll sit down and explain that home program to them, to the patient. The main goal of a home program is to continue at home as much as possible with the treatment that they're doing here. I know that we have things that are complicated to use at home, and IVs and things, but definitely we have treatments, supplements, vaccines. Like you mentioned, is different for each patient, but the main objective is for them to continue with the same treatment as much as possible for the effects to continue at home. My success rate has been probably in the high 70s, right? 80%, which is extremely high for cancer patients. But again, each situation is different, and a stage 4 cancer can come here in very different clinical conditions. So it depends a lot on the condition of the patient, but and definitely is different for each cancer. But in general, that will be around the numbers that I can tell you.